This is the Emergency Medical Minute.
So good morning, everybody. I think we are kind of officially ramping up in terms of flu season. So I was going to talk about a recent study that had to do with the effectiveness in Tamiflu in pediatric patients. So, there is a treatment for influenza, as we know, but it's controversial over how effective it really is. So this was a nice kind of meta-analysis that looked at a bunch of studies at the effectiveness of Tamiflu for specifically pediatric patients. And they had a good number of patients altogether. It was about 1,500 patients with confirmed flu and about 2,500 patients with suspected flu. And first thing to talk about is, just the duration of symptoms. Does it get kids better? And there was some benefit to Tamiflu in the cases where there was confirmed influenza. Patients got better 18 hours sooner, so almost 1 day less of symptoms. Whether that's significant or not is hard to say. And then in cases where it was just suspected flu, like let's say we didn't want to do the test, we just wanted to treat the kids because they had a fever and a cough, there was only a benefit of about 8 hours of improvement. So the benefit actually was more significant if patients were treated within the first 24 hours and they had the confirmed flu. So, that's a rough idea of how effective it is for that. In terms of other kind of complications, the only thing they could find was with otitis media. In confirmed cases of flu, there was about a 1/3 decrease in otitis media in confirmed flu. If it was just suspected, then there was no benefit for reducing the likelihood of otitis media. In terms of kind of hospitalizations or other, more concerning things like deaths, there weren't enough cases in either, in any of the cohorts to know whether there was benefit. So, in general, there might be a little bit of benefit, but it's not a miracle drug that, makes your flu go away instantly and, saves everybody from, all the bad complications. I personally don't think there's a whole lot of benefit to, testing or treating. So most healthy kids over the age of 2 probably don't have a whole lot of benefit to either testing or treating. In the youngest kids, anybody with, asthma, other illnesses, other chronic illnesses, might be worth it, might help get them better a little bit sooner. Any questions? Thank you.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.